Hello, everyone. Thank you all for coming. My name is Anaisa Quintanilla Arteaga, and I am the president of PathSig and currently a third-year med student at Loyola Stritch School of Medicine. We're very excited to present the first event of our annual Spring Symposium with our pathology post-match panel discussion today. Just as a reminder, this session is being recorded, so please make sure that your microphones are muted during the session. We would like to thank you all for your attendance and hope that this session is helpful for those who will be participating in the PathMatch 2025 and beyond. At this time, I'd like to invite my co-moderator, Jenna, to introduce herself.
Hi, everyone. My name is Jenna Angst. I am a second-year medical student at LMU DCOM in Knoxville, Tennessee. I'm also the vice president of PathSig. So now I'd like to ask each of our panelists to introduce themselves and where they will be for residency, starting with Jerome.
Hi, everyone. My name is Jerome Givey. I am a fourth-year med student at West Virginia University. Previously, I was the post-sophomore fellow here at WVU. I'm also one of the event co-chairs for Virtual PathSig. I just matched at UPMC.
Congratulations, Jerome. That's amazing. And let's move on to Kaylee.
Hi, everyone. I'm Kaylee Fox. I am a current fourth-year med student at LMU DCOM in Harrogate, Tennessee, and I just matched at Wake Forest in Winston-Salem, North Carolina, and I'm doing APCP.
That's awesome. We're so glad to hear it. Thank you, Kaylee. Tristan?
Hi, everyone. My name is Tristan Jordan. I'm fourth year at the George Washington University School of Medicine in Washington, D.C. I'm also one of the event co-chairs, like Jeremy, and I will be starting residency in July at Yale New Haven.
Congratulations, Tristan. Now, Samir?
Hi, guys. Can you hear me okay? Just want to make sure.
Yeah, we can
Hello?
hear you.
Okay, cool. Hi, everybody. My name is Samir. I'm a fourth year at San Juan Bautista School of Medicine. I recently matched into USF Tampa, the Moffitt program there. So go Bulls, and it's APCP.
Awesome. We're excited about that for you. And now, Shu.
Hi, everyone. I'm Shu Garcia. I'm a Filipino international medical graduate, and I'm an incoming PGY1 at Northwestern.
Great. Thank you all so much for joining us. Let's dive into some of the questions that we have for everybody today. The first question will be for Shu, and if the other panelists, want to jump in at some point, please feel free. What factors influence your decision to pursue pathology as a specialty?
So, like this question, kind of reminds me of the question that comes up in all of the interviews, which is like, why pathology in general? And my answer for that would usually be twofold. First is I love pathology because I love mountains. And that is a weird statement because for me, mountains signify something that you need to conquer, something that is always a challenge. And I think pathology is that it factor for me. You know, there is not a boring day in pathology. You always need to know something else, something new, and something to always climb to, a new height to go to. And that is one thing. And the other thing is I love pathology because I love patients. And as pathologists, we are the ones who will start the journey of healing for our patients. Our diagnosis is that first step for all of our patients. And being that physician for them that will guide them through that first step, I think is a gift that I want to have in the future. So if someone asks me why pathology, is because I love mountains and I love patients.
Shu, that was such a beautiful and eloquent answer. I hope you use that in interviews.
I use that.
Yeah, that was beautiful. I do just want to add for maybe those of us who are not so so eloquent and as well spoken as Shu. I came into medicine wanting to be a forensic pathologist. So I knew that, I had to go to medical school and then I had to do all the things to become a forensic pathologist. So really that's what introduced me to pathology. But once I started doing some rotations and trying to seek out exposure, you see how wide reaching and how much more there is to pathology than just what you think. So the idea that like we are able to be a part of that diagnostic procedure for patients and really guide patient care and be that starting point on the best and worst days of somebody's life. I think there's a lot of gratification that comes out of that, and the teamwork, the cerebral nature of the work that you do, it feels really powerful to be a part of.
Yeah, I am also less eloquently spoken than both Shu and Kaylee, but some of the initial things that really got me interested in pathology and made me realize it's one of the potential fields I was interested in pursuing was, for me, I was really interested in genetics, and I learned that molecular genetic pathologists are the ones who interpret the genetic testing. They're really involved with running the genetics labs, as well as just really there's a lot, even if you go into other fields of pathology, there's genetics involved. And just in general, pathology is a really good field for those people who are interested in like the basic sciences. That was kind of my background, was like biology, genetics, genomics, things like that. And pathology was the perfect field to pursue for those things. And then on top of that, I think one of the one of the parts that really make pathology a hidden gem is that the work-life balance and just the overall burnout rate of pathologists is really low. If you look at all the surveys of the national surveys, pathologists are burned out at a much lower rate. And so for me, when I was talking to someone who was going into pathology as a fourth year med student, when I was a first year, he was just like, yeah, I mean, realistically, like I'm interested in, internal medicine and surgery and all these other things, but longevity wise, I just don't think there's really a field I could see myself doing for, whatever, a 30, 40-year career outside of pathology. And to me, that was really important because, I'm always been interested in medicine, and pathology holds a really important part in the patient care ladder. But I want to be able to do it and enjoy it for a long time.
Yeah, I also want to echo Jerome in terms of my passion for pathology and how it really allows me to kind of blend my interests in medicine and the basic sciences. So before medical school, I actually worked at the NIH for a couple of years, and that experience sort of made me appreciate studying the mechanisms of disease. And then also during my first couple of years of medical school, I was really fascinated about the microanatomy and the histopathology because it breaks down disease into the tissue and molecular level. And then during the third year of medical school, that's really where I realized that pathology is for me, because after doing all of the rotations in pathology in my medical school, I did surgical pathology, I did autopsy, as well as clinical pathology. I realized that pathology is the field where you make definitive diagnosis, which really is the foundation of clinical decision-making, like treatment and staging. And also pathology has so much to offer in terms of generating new advances in medicine. And so I think it's a really cool job to be able to help solve health mysteries and also make a really big difference in the lives of patients.
And speaking to that, it's what I've realized that it's a really popular field for people who have MDs and PhDs because of that ability to do a lot of research, both clinical research as well as basic science.
And then just to hop onto that and finish real quick, with MD, PhD, there's also been DOs are really kind of pushing in and getting the opportunities within pathology, which is really exciting to see as a upcoming DO grad myself. It's really cool to be a part of that DO representation in a field that, most DO physicians, I guess, don't really get exposure to or know that that's an option.
Great. We'll go ahead and move on to the next question. Jerome, if you want to start us off with this one, can you share your journey towards matching into pathology residency, and what were the key steps that you took during medical school to prepare for this specialty?
Yeah, so my path towards pathology is a little bit of a weird one because I did a post-sophomore fellowship. But pretty much I didn't really know what pathology even was until my second year of medical school. And when I started to realize what it was, like I said, I'm really interested in genetics. It really started to check all my boxes, but I really wasn't sure what exactly a pathologist did and like what their lifestyle, what their life is actually is, like what is the day-to-day life of a pathologist. And if I had just gone the normal 4 years, I would have only had like a month or two before application were due for residency to get exposure to pathology. And I mean, that just didn't really sit well. So I learned about a post-sophomore fellowship that my school, WVU, had to offer, which was essentially after my second year of med school, take a full year and essentially act as a first-year pathology resident for the year, as well as have some time for research. And I did that, and I did it mainly to help me decide that pathology was the field for me. I was like, I'd rather spend a year and realize, yes, pathology is or pathology is not the field that I want to pursue. And I think either way would have been helpful. For me, it was really helpful in the application process, having all that experience and really knowing exactly what I'm getting myself into. And if I didn't like it, I think that would have been a year well spent just intrinsically, but pathology also kind of touches every other field. So I think it was helpful for my third year rotations as well. But then after my post-sophomore fellowship, in my fourth year, I really only did 2 pathology rotations, one at my home institution, and I did one away at UPMC actually, which is, I kind of had an open mind to, I interviewed at a lot of great places, but UPMC was always the one that I really wanted to be because I'm from Pittsburgh. And just a lot of other things outside of just the amazing program that I love pulling me there. So so that was really my whole kind of process, start to finish. And of course, you have to do the application, the interviews throughout the whole season as well. And then attending the miscellaneous conferences as well that we can maybe talk about later. But yeah, that was my path.
Yeah, for me, I didn't do a post-sophomore fellowship, but for me, during my first 2 years of medical school, I sought out my pathology course director, the professors who were teaching us the pathology topics during the first 2 years, and asked them about the day-to-day activities of pathologists. And then I got connected to a bunch of pathologists in my home institution's hospital to be able to shadow them while they were signing out cases. So that was just sort of my initial exposure to the pathology practice. And then also during those first 2 years, I also was involved in my university's pathology student interest group, which allowed students to interact with faculty as well as residents. And then during my third year, as I mentioned previously, I did as much pathology rotations as possible, and then did 2 away rotations as well. And then one thing that I would highlight is the fact that during my core rotations, say in surgery or OB-GYN, I tried to actually shadow pathologists during that time as well. When surgeons are asking for frozen sections, I would always sort of ask my surgeon if I could follow the pathologist during that time. So those were what I would say are my key experiences that really prepared me towards a career in pathology.
If I can, I kind of want to jump in and I guess share a little bit of like a different experience that I've had from is it Jerome or Jeremy? Okay, Jerome. Okay, thank you. Then Jerome and Tristan, I came into medical school. The whole reason I pursued medical school was because I thought I was going to be a forensic pathologist. My entire life. And then starting med school, people were always like, oh, Kaylee, are you sure you want to do pathology? Like, you just don't seem like a pathologist. You really need to be with people, with patients and blah, blah, blah. So, I heard it, I would shrug it off, whatever. I started med school. Histo was one of our first classes. And of course, me being pathology minded. You know, I was like, well, I need to be good at this. Even if I don't love it, like I need to be good, because everyone in my class was just like, oh, I hate histo. What is all this pink and purple, blah, blah, blah. I loved it, but besides the point, I made a point to be good at it. And then kind of during my first and second year, you know, after I've heard so many people telling me like, Kaylee, like you might want to look into something else, just like open your mind a little bit. I did. And I, you know, thought about surgery and thought about urology too. So it was kind of during my first 2 years thinking that I was kind of going to pursue a different field. And then I started third year and started patient care. And it wasn't until I had a pathology rotation, which I would suggest doing if you have any interest in pathology, is making sure you can get a pathology elective in your third year. That way you can prep yourself for fourth year rotations better, so you can understand what you do or don't want in a residency program. But really that third year rotation in pathology sealed the deal for me. And I felt like I had finally, you know, even if it didn't check all my boxes because it was surge path and I had never really experienced that before. It didn't check all my boxes, but it felt like home. And it felt like for the first time in my third year, that was what I was supposed to do. Fast forward to fourth year. And then I did a forensic pathology week, and it just all made sense. And the whole reason I've done this was like reaffirmed. So just my experience with a little bit different than being like, yes, I'm doing pathology the whole way through, because I did change my mind for a little bit.
Kaylee, since we just heard from you, do you have any thoughts on when a student should start preparing for the pathology match and what types of things they should be doing? Kind of similar conversation that we've been having. When is too early or too, you know, when is the right time frame to start?
Sure. So I don't think in terms of preparing yourself for pathology in general, honestly, I think preparing yourself to match in general is the kind of attitude you should have from the start of medical school to the end. I think, you know, with the way that graduate medical education in this country is going, and then we're opening more medical schools and we still have the same number of residency spots, and we have our US IMGs, our non-US IMGs who are also coming in. You know, there's unfortunately not enough spots for everyone. And, you know, we should be guaranteed a job if we're going through medical school, especially in the US and getting all of this debt, because I cannot pay for it myself. But that's my little soapbox. So begin preparing yourself to be the best applicant you can be from the start of medical school. Now, pathology match specifically, you know, I think that will begin after your third year pathology rotation. You're like, yep, that's what I'm doing, blah, blah, blah. So now you can start to think about, and it is kind of difficult to think about what, like a personal statement for pathology and those like why pathology questions, because you've been asked completely different things all through medical school. We are not trained to become pathologists in medical school. So you're really trying to convince and share why you're pursuing a field that is so niche almost to a lot of pathologists who already are in their career and are really happy and proud to welcome a new group of pathologists in. So, you know, I would start thinking about that personal statement early. What matters to you? What do you value? Why does pathology give you those opportunities to flourish those values? And then, you know, third year, when you're scheduling your fourth year electives, get on it early, get as many as you can. And that, I think that'll help you feel well prepared for what you're looking for in a match and in a residency to match at.
Yeah, I would echo Kaylee's sentiment about just, especially early on when you might not know that, you know, one specialty is for you, just kind of making yourself the most, you know, the best applicant in general, you know, whether that's doing community service or research or really anything. But I think once you come to the point where you're really like, I am applying pathology, it's what I want to do. I think then it's time to really try to key in on doing things that are specific to pathology, because you get that question a lot, why pathology? Like one of the things the program directors are looking for is like, does this person really want to do pathology? Like what experiences do they have in the field? And I think the earlier on you can get in there and make that decision. Of course, you could figure out pathology is your cup of tea late in your third year, so you might not have all the time. But I think in general, the earlier the better. But it's not a huge rush. If your first year, if you're coming in the second year, like I haven't done any pathology, I wouldn't worry. But I think once you make that decision, then it's time to try to do some research with the pathologist, or do some research where there's pathology or histology related to it, or something along those lines. Try to go into your departments, like journal clubs, and go to the department talks. Make sure the faculty know who you are, so you can get good letters of recommendation. Try to do community service related to pathology. Join groups like Virtual PathSig to show your commitment, and try to go to some of the big pathology conferences. There's a lot of good travel awards that will pay for medical students to go. There's not a ton of medical students going into pathology in general, so they like the ASCP, the USCAP. I just was at the US and Canada Association for Pathology, like the biggest pathology conference in the world, and they paid for me to go to this genomics workshop for medical students. And so really all the biggest path meetings has travel awards for medical students that I'd highly recommend as well.
So if I might add, so once you've determined that you want to pursue pathology, I think what was helpful for me was documenting a lot of the cases that I've encountered during my pathology experiences, and like writing down what I learned after each case and how it impacted my interest in pathology. So I think this strategy overall kind of helps document your journey in pathology in a very systematic way, and also kind of determines how you developed as a budding pathologist. And it's really helpful because if you want to start writing your personal statements and also preparing for your interviews, it's a really handy document to have.
I just want to like echo one thing that Kaylee said, and it's pathology is getting more and more competitive. I'm just saying it. Like it's not like enough that you show pathology in the CV. You should reflect it like all throughout the whole process. And what all the other speakers have been saying, the earlier the better. That time when you begin to pivot and say that pathology is my thing, look for a mentor, because that mentor, who is mostly a pathologist, would be the one who will guide you through like projects and research stuff. For me, that it was that way. It was that one person who guided me and like held my hand throughout the whole process, and eventually helped me match.
I had a question in the chat that I just wanted to address in case anyone didn't see it, and for all of my DO friends, which does go towards this question. Daniel had asked if I took step and level, and yes, I did. For me, again, this was at a time where I thought I was applying to urology, so I was like, well, I guess I'm gonna have to take step. So I had already prepped to take step 1 and level 1 together. And then by the time I had step 2, I figured, why not make sure, I can get a decent score and blah, blah, blah. I already took step 1. Why not take step 2? While I do recommend that, if you only take level 1 and level 2, I have had friends in this pathology match who successfully matched into pathology. I will say and preface that I do think having both will make you a better and more well-rounded competitive applicant. Because unfortunately, while the stigma with MDs versus DOs is decreasing, it very much still exists, and pathology is a very academic specialty. We're kind of not granted that same opportunity that maybe a lot of our peers have, where they can match at more community hospitals. There's really a ton of academic programs for pathology. And so I will say that a lot of academic programs will require and or prefer a step score. So being able to have that just really opens up a lot more opportunities for you. And I don't think you need to take step 1. I think, well, Is that a lie? I think DOs can pick and choose if they want to take step 1 and or step 2. So I think what matters is probably a step 2 score. So it's not too late for you if you did not. And really step 1's pass fail. And I think if you could just get a step 2 score that's 230 and up, you know, obviously the better, awesome, but get a step 2 score that they can look at and be like, okay, I know what that means, because a lot of people don't know what a complex score means.
That's really helpful. Thank you, Kaylee, for me as well. I was going to ask that question and somebody else did already, so that's perfect. Beat me to it. Okay, so our next question, I'm going to direct this to Tristan. How do you go about securing external electives, and how many external electives should you pursue?
External meaning away rotations, right?
Yeah.
For pathology, there is a lot of the programs that I did away rotations at, they have you have to use VSAS or VSLO, and I submitted my applications around March, and I got acceptances as early as 2 weeks later, and then I did those rotations, I believe July and September. If you're applying for an away rotation, so now it's already March. If you haven't done so, it's really important that you submit that application as you can. And some of these applications involve a letter of recommendation from 1 or 2 people, and also as well as a CV. If you're applying next year and not this year, I would try to get that done as early as possible, perhaps as early, try to get everything done by the end of January, so that by the time VSAS opens at, I believe, early February, you're able to submit the applications right away. But I think submitting now, I think there's still a lot of programs that are open right now. So if you can just submit those applications for those away rotations, that would be ideal.
Yeah, I would add that I think the number of away rotations of one person it's not really a one size fits all. You know, if you're someone who doesn't have a ton of pathology experience in rotations at your home institution, you might want to add, do 2 or 3 or 4 rotations at other institutions. But I mean, if you had a little bit more pathology experience throughout your medical school, then you may not feel that you need to necessarily do a bunch of away rotations. You can just get away with doing a few at your own home institution. Now, I would say that doing away rotation at another institution, like I did one at UPMC again because I knew I really wanted to go there, and so I really wanted for people there to meet me, to know who I was, to know that to really put a face to the name. It's instead of just having an application on paper. And so I would say and the thing is with away rotations is that they're expensive. I just learned that IMGs have to pay for them out of pocket, which I thought was kind of crazy. For a US MD graduate, I think it just came out of my normal tuition for med school. And for me, going to UPMC, I had a place to stay as well. So I know they can get expensive, but I would say if there's places you really want to go, I would try to go there. But don't go bankrupt trying to get away rotations would be my advice.
And I cannot stress enough, I think, the importance of, having a program list and having things that you're interested in, programs you're interested, a geographic region that you'd like to stay in. If you're able to secure an away rotation there, it is so important, because I had rotations on my list that I went and I was like, this is not for me. And I was able to not, waste my interview energy on them. I was not, I didn't have to waste the payment of adding another program because I knew that that wasn't for me. And I think it's important that as a incoming pathology resident, again, medical school does not prepare you to become a pathologist, let alone a pathology resident. There are so many niche things in a pathology experience and in that learning experience that you might find that you like. Do you like a 1-day schedule for grossing? Do you like a 3-day schedule for grossing? How do they do sign out? Do you sign out in the attending office? Do you like to do a general sign out versus subspecialty? These are all things and lingo that you learn by doing those away rotations. So then you can decide when, you know, you're ranking your list and you're interviewing with programs, what's important to you.
I just want to tag something really quickly onto these answers. Just a quick plug for our friends over at Match to Path. So they have a pretty comprehensive worksheet or spreadsheet, I'm sorry, on their website of observerships and elective rotation options. And then the National Association of Medical Examiners has kind of a confusing to navigate, but great resource. It's called the Forensic Training Database as well. So you can get into that, and they have quite a few medical student rotation options listed. We do have a reel on our Instagram page at Virtual PathSig, so you can always refer back to that or shoot us a DM if you need help accessing any of those resources.
All right, our next question, I'm going to direct to Samir. So we've been talking about away rotations and electives and all of these application things. Can you just briefly give us an overview of the application process and the timeline, and any advice you have for med students who are currently in the process of preparing their applications for the next match cycle in pathology?
Okay, so that's a pretty comprehensive question. So the first part is preparing documents for the next match cycle, right?
Yeah, so when would someone start their aways and then start preparing, kind of like a timeline for everything? And
Sure. So, and I'm sure everybody else will help chime in as well, but usually, you know, end of third year, summertime is usually when people start taking their step 2. After step 2, you want to start getting your elective rotations and any required rotations for fourth year kind of set. By that point, you should kind of have the programs that you want to apply to in mind so that you can go rotate potentially at those sites of interest and, you know, meet the people there, make connections, etc. My situation's a little bit different. I did my med school in Puerto Rico, and I'm originally from the Fort Myers, Cape Coral area, which is in Northwest Florida. I already had in mind from the beginning of med school that I was going to rotate at my local hospital here in my hometown. So my hospital is not even in Vislo. I had to just reach out to the coordinator of the hospital and let them know I'm coming from PR from my school, which is a US based program for anybody that doesn't know. And I'm coming back home. So would I be allowed to do all of my elective rotations here? Tiffany, that's what I'm talking about. Go Fort Myers. Reach out to me if you have questions. But yeah, so I essentially rotated with Lee Health, which is the main hospital system here in the Fort Myers area. And through them, it's been awesome because, you know, like Jerome was saying, through Vislo, some programs you got to pay, and we're broke. So I think it's kind of ridiculous that through Vislo, you have to pay money to rotate at some of these programs. So I said, if I can rotate in my hometown, I can get any specialty provided through my hometown. You know, I've done infectious disease, I've done pediatric ER, I've done neurology, like any rotation. If you're US based, if you go to your local hospital, if they have it, chances are you could probably rotate with them and not have to pay anything. So that's one thing to consider. So let's see, preparing for the match, step 2 scores, going through the interview process. Again, my situation was a little different. I only applied to the programs in Florida. There's only 8 pathology programs in Florida, and I only got 2 interviews from there. So I'm very fortunate that, you know, USF gave me a shot. But most people apply to 50 different programs, and they have to travel all around the US to get interviews and go to sites. I know things are virtual now, but you know, if you really want to go to a program, I agree with what Kaylee was saying. You know, go to the university, meet the people there, see how things operate. I don't know. I think I jumped around, but is there anything else you want me to add to that? Sorry.
No, you did great. Any other pieces of advice you'd have for students preparing for this next cycle?
Yeah, so what I would say is there's a lot of virtual resources available now to people that want to go into pathology. Kiko app, for example, is an app that pathologists have made that allow you to kind of jump in on case reports. If you've never had experience writing a case report, now we have, tons of opportunities to get in touch with pathologists and kind of let them know that you're interested in the field and that you like to work on something. Any paper that I've been fortunate enough to be a part of was from during my undergrad. I did internships. I think similar to Tristan, I was at the NIH. I worked there in a mouse model lab looking at Alzheimer's, and that's kind of where my research came in. I've never directly worked on like a pathology human case report. But that was kind of my research experience. But there's so many resources now that if somebody wanted to work on a case report, people can do it, and you can be anywhere in the world and you can work with pathologists, US based or international, from the computer, which I think is amazing. That's about it.
So I'll just kind of describe a little bit of like the actual like structure of the application and timelines and things like that. Because I knew that was one thing that I never really had a good grasp of until I was actually in it. And by then it might have been a little too late, but I think applications open, like the ERAS applications open like in July, August, somewhere in that range. And then what that entails is kind of just like your CV, which when the ERAS application is now it's 10 experiences. So you can list up to 10 things that are the things that you want to highlight the most, whether that's volunteering, research, interest groups, things like that. So you have 10 experiences, you can highlight 3 to be the most meaningful, just to kind of have an idea of what you're going to be expected to write, as well as your personal statement, which is arguably the most important thing, as well as space for up to, I think, 4 letters of recommendation, which I think we'll get into in a little bit. So that's really the brunt of the application. Pathology had a new thing this year where you can have up to 5 signals. They're all the same. I know some crazy matches have like gold, like 50 signals, some gold, silver, bronze, but we just have 5 signals. And you can also list up to 3 geographic preferences. And it took me a while to really wrap my head around like what the rules were with the geographic preferences, but pretty much if I apply, I think it makes sense to put 3 geographic preferences. And if the place that you're applying is within those, they will know that they are within your geographic preferences, and you can have short little spiels as to why you like that region. But if they're not in your geographic preferences, they'll just see it's not, they don't know which ones you picked, but they know they're not in it. You can also not put any geographic preferences at all, and all the programs will just know you did not list any geographic preferences. So what those are supposed to be are for PDs to decide who to interview, and then once the interview happens, they really aren't supposed to consider it. But this was the first year of it, so I would check back at our PD panel in the fall for that. But and then from there, it's I think it's September 27th of this year was when programs can finally start to see the applications, and then from there, interview season rolls all the way until I'd say maybe even late January, February. So yeah, that's just kind of a layout of the whole timelines, because that was one thing I did not really know about until I was thrust into it. So.
Yeah, generally your interviews, it was looking like, I took a second to take a look at when a lot of our interviews were, looks like really early, maybe mid-September, but mostly end of September into January. I personally was done in December, but yeah. Oh, and that's interview season, by the way. And then I think like rank list happens, it opens. Guys, I can't even remember, but it opens. Okay, you have a long time to put your rank list. Yeah, you have like the whole month of February to put your rank lists in. And so you're just constantly checking it, and then you submit it, and then you have 2 weeks before match week. So yeah.
Yeah, so I would recommend that when you're submitting your application, which is at the end of September, um, like you're gonna probably get a lot of interviews. The bulk of it happens in October, and a lot of my interviews were scheduled from as early as mid-October to as late as late December. But my other friends who were also applying to pathology, they got interviews as late as I think mid-January. So expect like a long cycle up until like the end of January. And during the times that you're going to do your interviews, I would recommend that you schedule those months for kind of not super busy rotations. Or if you can schedule a dedicated block just for interviews, so you don't have to work around your rotations. For me, I scheduled my emergency medicine rotation in December, and it worked very well because my ER shifts are during nighttime and my interviews are during the daytime. So kind of just keep that in mind when you're sort of thinking about which rotations to pursue during those interview months. And then during January, I think during the end of January and pretty much during February, there's going to be second looks where you have the opportunity to visit the schools that you've interviewed at to kind of see what the program is like, in person, because it's very different to kind of experience a program virtually versus in person. And for me, I think doing the second look was very important in sort of like solidifying and like changing my my rank list to the one that is the most accurate in terms of what I really like. So I think that those are the things that I would add.
Okay, great. So kind of related to a question I'm seeing in the chat right now, in reference to recommendation letters. Who do you all suggest to turn to, and what's the best time to ask for a letter? And this question is for Shu.
So again, this is a difficult question to answer, but I think aside from the personal statement, from your step scores, I think having a very solid letter of those letters of recommendation should be very, very solid, because out of all of the materials that you will submit in ERAS, the letters of recommendation will come from another person. It will not come from you. So it is, I think, one of the things that program directors might trust more, because it is something that you cannot fabricate. These are stuff that other people are talking about you. So one tip that I could say about letters of recommendation is if someone you rotate with, like if a pathologist that you rotate with actually offers a letter of recommendation, actually says that, hey, I would like to write a letter of recommendation since you're going through the match, take that offer, because I am sure that that person will give that strong letter of recommendation. I do have like for letters of recommendation, I have three like pro tips that I kind of learned throughout the cycle. First is you are given a chance to either submit 3 to 4, I think, 3 to 4 letters of recommendation. And I think it is very strategic if those 3 or 4 letters of recommendation show different sides of you. If one letter would comes from your like research coordinator, the other should come from your clinical like would show your clinical side. For IMGs, what I did was one was from my home country med school, so she knows like the stuff that I did in med school. One was from my research mentor, and he knows like everything that I did in research. One was from my advocacies in LGBTQ health and women's health, and that shows another side of me. So these letters of recommendation shows like different perspective or facets of me. The second is this is another like thing that you can do is you can compound your letter writers. What I mean by that is you can have 5. For example, if I rotate to a certain program and there are 4 pathologists that are willing to write you a letter of recommendation, if those 4 pathologists are just going to write the same thing that, hey, he's like he does really good job in this lab and that lab and stuff like that, you can put it in one letter just to show that, and have those different letter signers like sign the letter. I got this pro tip from one of my friends during the match. And the last thing is, if you do need to request a letter of recommendation, try to schedule a call or a Zoom meeting. Do not request via email, because you want that letter to be very organic and very personalized. So that call or that Zoom meeting is just like a 30-minute, 15-minute like meeting of you just telling, reminding what you've done, what your goals are, and what you want to achieve during the match. And I think those like small calls or Zoom meetings actually made me have those very, very solid letters of recommendation.
So I want to add that it's very important that once you've determined your letter writers, to make sure that you ask them, like, as soon as you can. I would say no later than 2 months before the letter is due, which is late September, because attendings are very busy, and um, sometimes like they lose track of things. So it's very important that you always sort of remind them, and if they don't respond, like remind them, like every week, to sort of just to make sure that they get that letter in, because it's a really important part of your application. And I also agree with what Shu said about making sure that each letter writer kind of talks about a different side of you, so that each letter has just a sort of purpose. You really want to make sure that that you use that to your advantage. So.
All right. Thank you all so much. Next question, we will aim at Jerome. Do you have any tips of how you prepared for residency interviews, and any memorable interview experiences or questions?
Sure. So for me, I made one Word document of just kind of outlining all like the most common questions. Why pathology? Why this program? Talk about your research. Really know your research in and out, because you might get someone who's really interested in that paper that you worked on in your first year of med school that you don't really remember. So brush up on all those things as well. And I just had a document where I just outlined the answers. More so, I mean, for me, just making the document was helpful, but then I had it, if I had to reference it during the interviews, I tried not to, but if I was kind of getting stuck, I could look at that real quick and just glance over and just bullet points like, oh yeah, this is what we did and this was the experience. So that was one document I had that I always used. And then another document I would make for each interview is I would look up the site, look up their website, see what all they have. A lot of programs will send you like a packet or videos of like things about their program, things they want you to know, to just kind of make the interview more productive, so you know exactly what the program is all about, what their rotation cycles like, what it's like living in that city. And so that would be another piece of advice. So prep for the interview questions. You'll always get why pathology and why this program. From there, it can it opens up a lot. For some, I talked about sports with the program director for the whole time, and they just want to know that you're a normal person. But so prepare the questions, really know everything on your CV in and out, and then know the program, know the specifics of it, and what exactly the structure of the program is. And then another thing is look up the people who will be interviewing it. Though almost every program will send you a schedule beforehand, and not even, I mean, you want to know just like what kind of pathologists they are, so you know what kind of questions they're equipped to answer. But then also they might be from your institution, so they might like I've had people who like, yeah, I graduated from WVU. If it's good to know that. It's go start off and say go Mountaineers, just kind of build that bridge a little bit early on. So those would be my biggest tips. Kind of let's think. Any weird interview questions I got? I got one. It was like, if you could have dinner with anyone, any three people, like dead or alive, who would it be? Kind of just stumbled through that one, but you'll get some weird ones. But I think overall pathology interviews are pretty laid back.
Yeah, I was just gonna say pathologists are, I'm biased, but pathologists are the coolest doctors and we are really easy to talk to. And it comes across in interviews. So really interviews, like they're nerve wracking, obviously, but honestly, people are so fun and really just want to have a conversation with you. That's what I found a lot of pathology interviews were like. I wanted to say something that Jerome had mentioned, looking up your people that you're interviewing with. A lot of times, some of the attendings that are on the interview board to interview the prospective residents are also people who were alumni from that program. So then you can be like, how do you see this program? How do you think things have changed from since you were a resident to now? What do you think it still needs to change? What's important? Because they can give a lot of really great insight in terms of what it's been like to continue to stay there and work there as faculty versus what time was like when they were a resident. Sorry, Tristan, I know I cut you off a little bit.
I just want to echo what everybody else has said. I just want to add that, again, like Jeremy had said, really review your URAS application, make sure that you know everything front and back, and be comfortable talking about them. And also, before your very first interview, I would recommend that you do a virtual practice interview with a friend or a mentor, just so you could sort of like have like a baseline and offers like things that you could improve on. And also, in terms of my interview experience, most of my interviews are basically traditional interviews, very laid back, like everybody else has said. And I want to tell you guys that it's very important that you like always ask a question, because a lot of my interviews, in the very end of the interview, they would always ask me if I had any questions, and it just feels really awkward if you don't have anything. So I think it's very important that you have a question that's reserved, just so it just shows your interest in the program if you have that. But yeah, I mean, overall, it was a very laid back experience, and it's just more of them knowing about you, and also it's about you sort of figuring out whether the program is the right fit for you. That's why it's very important that you ask those questions.
Yeah, definitely. I forgot to mention that. Fill all the time. Don't finish the interview early. That's kind of a bad look. But also, the other question I forgot to add, they always ask is like, where do you see yourself in 5 or 10 years? And you might not know what kind of pathologist you want to go into, what type of fellowship you want to do, but just have something prepared for that.
Yeah, I wanted to quickly just add on how important it is that you do kind of figure out a little bit about who's going to interview you. I'll give you just a quick example. I looked at the resident page for Moffitt, and I saw that one of the residents in their free time, they like to raise chickens. And I was like, that's pretty cool, because I don't know anybody that does that. So during the interview, I asked the person just flat out, I said, what's your chicken's names? And they went on a 15-minute discussion about why they named them Shadow or Penny, or people, this is a quote that I learned in high school and I've never forgotten. People don't care how much you know until they know how much you care. And it's as true then as it is now. So, really get to know people, and that'll take you far, no matter what you do.
Okay, we have one last question, and then we're going to go ahead and open it up to the participants here if you all want to ask any questions. So the last question, this is to all of our panelists. What advice do you have for international medical graduates who are interested in matching into pathology residency in the United States?
I'll yield the shoe on this one.
Okay, so like I'm an honorary international medical graduate. So, first of all, for everyone who is listening here, who's going into the pathology residency cycle and going to the match, it is hard. It is difficult. But know this, you are the pride, you are the cream of the crops of your countries. You're there because you're already the best of the best of your countries when it comes to pathology. So give yourself a pat on the back and say and just like breathe and say that I deserve to be here, you know? And other than that, you just need to have people who will root on you, who will actually support you. Build that community. I did not have the best researches, I did not have the best step scores, but I did have the best community that I can lean on, that can support me. I went into Path Twitter. I went there in 2020. And you know what? When I told everyone there that, hey, I'm going for the match cycle this last year, when I actually decided that I would go through it, like I got like 20 messages off the bat. Hey, do you want advice? Hey, do you want stuff like that? Hey, can we schedule a Zoom call? Like everyone are so like dedicated to help. And some of these people, you know what? They know other people who can actually get some like help and network in some of the programs that are offering residency spots. So be bold, you know, like you're already in that position, so be bold, be brave, and like look for that helping hand.
That got my heart. I was like almost tearing up. That's so sweet. Yeah, I think just to kind of go off what you said, now I cannot give any insight to what the the IMG experience is like. All I know is that being a DO applicant and graduate, and I can empathize slightly, but even then, like it doesn't touch the hurdles that you all have to jump through. And just like, I hope, Shu, I'm so proud of you, and to all of you other non-US and US IMGs, like you're doing incredible work, and just keep moving forward. I think as a DO, I think we're always trying to prove our worth, and same with IMGs. We're trying to prove our worth, prove our quality, and how much we deserve a spot as well. So, you know, you just need to stay true to yourself, and I think be gentle with yourself through the entire process. You know, even if you may have the top board scores, whatever. I kind of subscribe to the thought like there's always somebody better. So that's what I have to keep striving for. And just to be content with what you have and what you're bringing to the table, because you're not getting interviews at places that they're just interviewing you. Like, I would like to say an expletive here, but like for giggles, like they're not wasting an interview on you, that you're wanted if you have an interview. So to have that in your heart and in your mind that like someone wants you and you're wanted and you're bringing something to the table that they want, I think that gets you a long way.
Great, thank you all so much. If anybody has any last minute questions, feel free to go ahead and drop them in the chat. And just to wrap everything up, on behalf of PathSig, we just want to say thank you everyone for attending, and to our panelists for providing such great information. We wish you all the best of luck as you begin residency training. And just as a reminder to everyone, this session was recorded and we will put it online here in the next few days. So we'll be releasing registration information for the rest of our spring symposium events pretty soon. So just keep an eye on PathSig, all of our social media platforms, and feel free to DM us if you have any questions. Okay, thank you all so much.